Okay, fantastic. All right. Good morning, everybody. My name is Tatiana Calderon, and we'll be getting started in a few minutes. So we're just giving people a moment to get situated. So if you need anything, please do so now. And we'll begin in about 2 minutes at 10:32, just so we give everybody ample time to do what they need. And for those seeing us on Facebook, again, it will be starting in about 2 minutes, just to give people in the virtual space here on Zoom just time to get situated. Just a quick reminder to everybody who is in the Zoom space and seeing us on Facebook, this is a public forum. I'm sure everybody has plenty of questions, but please try to keep any personal information out of the questions. If you would like to reach out to Paola, who's our presenter today, about any specific questions, you can do so at the end. I will be able to provide you her contact information, just to keep private things private. Just as a reminder, everybody via Facebook can see us. Alrighty then. Just also a few more housekeeping notes. This presentation is being recorded and will be available directly on our Facebook at the end of the presentation. You will also be receiving a copy of the presentation in a follow-up email within the next 2 days. Also, there will be a poll at the end of this presentation, so we encourage you to please stay at the end of the presentation just to fill that out. It'd greatly help us. All right. And it's about that time to start. So good morning, everybody. My name is Tatiana Calderon, and I'm the Autism Initiative Coordinator here at Synergia's Metropolitan Parent Center. Just a few words about Synergia's Autism Initiative before we begin today. The Autism Initiative project is funded by a grant from the New York City Council under its Autism Initiative. This project supplements the work of Synergia's Metropolitan Parent Center by bringing increased awareness to New York City residents, particularly to communities with large Spanish-speaking populations, but the growing population of children diagnosed with autism spectrum disorder. Its strong outreach component targets families of children with a suspected or known diagnosis of autism spectrum disorder, ASD, who are not receiving appropriate educational, health, or other related services. The initiative will link them to other services and supports that meet the individual needs of children and their families. So I want to thank you all for being here today. We're absolutely thrilled that you can join us this morning, and welcome to Synergia. And just a little bit on our presenter today. Today we have Ms. Paola Martinez-Boone, who is the Senior Advocate and Special Education Coordinator at New York Lawyers for the Public Interest. Paola, thank you so much for joining us here today. I'm sure we have plenty of questions for today's presentation. There will be a Q&A at the end. However, if you do have a question throughout the middle of the presentation, it is not an issue. You can definitely ask it, and I'll make sure to read it to Paola. So here we go. Paola, I hand it over to you, and thank you so much for being here. You're muted, Paola.
Sorry. So thank you so much for having me. It's my almost pleasure always collaborate with agencies to provide education and outreach trainings to families, because with information, that's when you become the most powerful advocate for your child or adult with disabilities. So my name is Paola Martinez-Boone. My agency is the New York Lawyers for the Public Interest, and the New York Lawyers for the Public Interest is a nonprofit legal organization, and we provide legal services. Our services are free. We do not charge for any of our services, and we have different programs, and the biggest one being the Disability Justice Program, which not only we provide outreach training, but we also represent clients in different areas, special education, community. Is so much. I'm not gonna go into the details about my agency. I will suggest for you to look into our website, explore a little bit, and then see if you have any of something sparks in you that perhaps you may have a legal issue, concerned, and you want to reach out to us. The goal of our disability justice program is to protect and promote the civil rights of people with disabilities. It's very simple. And in terms of educational rights, to ensure that children with special needs receive special education services as they are entitled. Now, with this in mind, I think Synergia is going to have an education training coming up. It's always good to attend trainings. If your child is still in school, you still want to make sure that he or she is getting everything that they need at school and they are making progress. I think Synergia's one is coming up. You can actually probably reach Tatiana and ask her to send the information. If you miss the Synergia's training, New York Lawyers is going to have their own training in English on October 17. In Spanish is going to be October 19. You can sign up. You know, if you go to our website, you will see the flyer there, or you can reach out the office. So hopefully, you know, if you need that training, please try to, and they're all Zoom trainings, try to attend. Okay. The title of this workshop is called Planning for the Future When You Have a Child with Disabilities. And I'm gonna walk you from the things that you need to start thinking in terms of planning. And planning is not only for adults with disabilities, it's for children and adults with disabilities. And then I also gonna talk to you about what options you have in terms of decision making. So the first thing about planning is that we have to think about preserving government benefits, including Medicaid, Social Security. And I start with this because I have been doing this for a long time, and sometimes parents don't know how to plan and they leave money in the wrong places. Understand that if your child is a minor right now and he or she is a recipient of Social Security and Medicaid, you could be working, you could be earning a good income, but they have been eligible, especially for Medicaid, because it's something, the waiver. However, when your child turns 18 and under the law, he or she is an adult, then you're gonna have to apply as adults. So they're not gonna take into account your income either. It's gonna be just him. However, if you leave something behind, that's their income. And I'm gonna explain a little bit more of that. But one of the main thing here is preservation of public benefits, because if your child is attending public school right now, you know, it's free, you don't pay, but adult services are paid by Medicaid. Every single service is paid by Medicaid, whether it is if he's gonna live in a residential facility, if he, you know, gonna go to day program, if they're gonna take training, all that the payer is Medicaid. So that's why Medicaid is so important to preserve. And we as a families, we need to know where to leave the money behind. And I'm gonna tell you all about it. Also, to improve we need to plan to improve the quality of life of the person with disabilities. We want to know that, you know, they're going to be fine, that the services are going to continue, and they're going to have the appropriate people advocating from them, even when you're not longer here. So that is important. Okay, first and foremost, how do we start? We need to understand the individual's capacity and decision-making options. Once again, I was reading some of the questions ahead of time. Everyone is asking about guardianship, would lead me to believe that many of you don't know that is other options, such as supported decision-making and healthcare proxy, power of attorney. But, you know, this is not a judgment call. It's just that's why I'm here, because I'm going to give you all the information, because guardianship is not for everyone with a disability. Now, like Tatiana said, I'm more than happy to answer questions about the context of this information that I'm providing. However, if you have personal questions, I beg you to call me. I'm very good at getting back to people, just because in 2 seconds that you tell me your question, I'm probably most likely not going to be able to understand what you want. And I don't want you to provide your confidential information here. Remember, you're probably thinking that you're having a conversation with me, which is wonderful. However, I want to remind you that this is right now Facebook Live, Many people probably entering that way that I don't know. I don't even know who is in this forum. So if you have, I don't want your personal information to be out there. The same way when you open your Facebook and you want your information to be private, I want your information to be private. So if you have any questions, Tatiana could put in the chat the telephone number of the agency, my email, and we can coordinate a time to talk. I give you at least 30 minutes for you to talk to me about, what is it that you have in mind. Going back to the presentation. So first, in terms of planning, we need to understand what's going on with our child. We need to know the medical, the behavioral, the social, the vocational, everything that's going on with a child that is now becoming an adult, we need to know. If many of you already enrolled with OPWDD, you know your child already have a life plan, and the purpose of the life plan is exactly that, to identify your child's needs and then address them by connecting them to services, by connecting them to programs. If your child is in school, a lot of the services, speech therapy, occupational therapy, they're receiving that at school. However, if you, with OPWDD, they can have extra services that way. I don't want anyone to freeze and say, well, I'm not going to do anything. I'm just going to wait and see what happened. That is the worst decision. Why is that? Believe me, it breaks my heart when something happened to the caregiver and then the siblings are scrambling to identify what to do because there was no plan. There was nothing in place. So we need to work on that. We need to address our fears and start planning, because at the end, we need to benefit our loved one with disabilities and, put everything together for their benefit. Also think about what you have. I know a lot of the clients that I serve are in public benefits, and they sometimes think that, they don't have enough. However, by having a conversation with them, then I realized that they say, well, my husband works and they have a life insurance at his job. Or he also have a pension, or I have a pension. I used to work and I have money in a Roth IRA, or, I have a cousin that self-insurance and then we pay him $20 for the insurance. And then my next question is like, but who's the beneficiary of that insurance? Well, my son with disabilities. Okay, that's why we need to plan. Because if you want to preserve Medicaid and you bought a life insurance that you're paying, and the life insurance is for the child with disability, something happens to you, and he or she end up with $50,000, $60,000, even with $20,000, guess what happened? No more Medicaid, because eligibility for Medicaid, you allowed to have $14,750. So once again, we need to look into these things and we need to plan, and we're gonna learn here today. Okay, this is all the things that I'm gonna be talking about today. It's a lot. It's a lot, and I'm gonna go real fast. The first and foremost, I want to talk about the letter of intent, which is not a legal document. And I want to be clear. This is not a legal document. This is a map that you're going to draft about the day in the life of your son or daughter with disabilities. What happens from the moment that they wake up, from the moment that they go to sleep, who are the doctors, who is the contact person, what person you want him or her to be away from. All that should be in a document. Why is that? We just have terrible pandemic. Even though it was declared that the pandemic ended, a lot of people passed away, a lot of people got sick. What happened with people with disabilities? We have parents that didn't leave anything behind in terms of guidance for someone to care for the person with disabilities. So this is what the letter of intent does. If I'm your friend and you're a single parent and you got COVID, you already left me something that I could go by to help you to care for your child. But if you don't leave me anything, I don't know what's going on. Now, for those parents who are here and have kids with autism, they really understand that routines are a primary focus. So if you want me as your friend to follow your child's routine, so he or she have stability while you are at the doctor's office or where you're in the hospital, you need to leave me something. I don't know. How do I know if you didn't write it down? So once again, the letter of intent is not a legal document. You can update it, as you please. You can send it via email, text, whatever. Do something. If you type in Google letter of intent, you probably got samples there. So if you want to follow a sample, go for it. But please write something that someone else could follow. Give them access to the life plan so they also know about programs, who to contact, who's the care coordinator. All that information is important. Don't hold information, give information so someone could help you with your child. Okay, because we're going to talk about decision making, I want to clarify information about capacity. Mental capacity, that is. Under New York State law, everyone who is 18 is presumed to have decision-making capacity. So everyone who turns 18, disability or not, they presume to have capacity. Why is that? Because we cannot assume that everyone that has a disability doesn't have capacity or is an incapacitated person. So everyone at 18 is presumed to have capacity. Who is an incapacitated person? A person who is impaired by reason of mental illness or mental deficiency to the extent that she or he lacks sufficient capacity to manage her or his affairs. This is very big. Not everyone with a disability is an incapacitated person. And a person who is deemed to be an incapacitated person perhaps may have abilities or may have some level of capacity. And we have to look into that as well. And we're going to go into who's the guardian, a person who's been appointed by the court. That's important because many parents call me and said, well, I'm the parent. And I say, are you legal guardian? And they say, yes. And I said, do you go to court? And they say, no. So if your child is an adult, guardianship, by the way, is only for adults with disabilities in the context of decision-making. If we're talking about family court and divorces and who's going to be the guardian, that's different for minors. This guardianship that I'm talking about is for adults with disabilities, okay? And the court is the one who approved the guardianship. There is a process that we're going to learn today. Now, because not everyone who has a disability needs a guardian, there are different things that exist for decision-making. Surrogate decision-making is any individual who's authorized by law to make a decision for another. And then we have the Family Health Care Decision Act, that is act providing a process for a surrogate decision-maker to make end-of-life decisions. So everything have like a little process, and we have to learn about that. Okay.
Paola?
Yes.
Sorry, before we continue, we do have one question and one chat. So Ms. Martinez in the Q&A is asking, is this also for children who are already in residential placement too? How can I prepare for this if he has OPWD eligibility? Sure if he still has since he got placed in August 2023. I'm assuming that is referring to the residential placement.
But we're talking about residential school or residential placement for an adult, because that's a difference.
School. The child is a minor.
If this is school and the child is a minor, you're still the parent and guardian. Once again, the guardianship is only for adults, and the fact that the child goes to school doesn't mean that they are the decision makers. You are, unless something happened and I don't want to get complicated, but if you from the get-go you were in the guardian because parental rights were removed, that's a different issue. But if you place your child in a residential school because that's what the appropriate placement for this child, and your rights as a parent were now removed through a family court, then you're the guardian.
Thank you, Paula. She just does clarify. She just wants to prepare for when he becomes an adult. He's currently at residential by the DOE.
We're gonna talk about everyone, whether your child is in a residential facility or is living with you, the rules are the same. Because a child goes away to a residential school doesn't mean that you lose your rights. It's just a school because that's the appropriate setting in terms of education. And we're going to talk about how to go about guardianship, because once again, I want people to kind of stop being a little bit fixated on guardianship and open their minds about what else could work for the adults with disabilities. So once again, even though I'm going to talk about guardianship, because there are a lot of people who need guardians, not everyone who has a disability needs a guardian. All goes into that person's capacity. So,
Thank you, Paola. And just one more chat. Ms. Rodriguez says, I do an email twice a year with info and send to my loved ones about my son. Is that considered to be a letter of intent?
A letter of intent is just a sample. You do it whichever way you want. It doesn't have to be titled letter of intent. I don't even know where that title came from. But whatever you do to let people know, you know, what's going on with your child and what he needs, he wants, and where he's going, that's perfect. That's what you need to do. You need to let people in, you know, in terms of what's going on with your child. And that's all that, you know, I'm presenting here today, that, you know, allow other people to know what's going on. Okay. So if something happens to you, and I'm not talking about that, I'm talking about illness, and, you know, you can go for a hospital with a cough and they might leave you because it's something else. Who knows? Anything could happen to us. So that's all I'm asking. Okay. So how do evaluate decision-making capacity? Because that's the other question. I have a child with disabilities. I don't know what his capacity. So one of the things is like how that person explores decisions. We also have to understand that we are working with people with disabilities. We have to balance respect for the individual's self-determination and protection of their well-being. This is sometimes a very difficult task for parents, because parents, we are so used to tell kids what to do that when they become adults, we cannot stop. And once again, the fact that a person has a disability doesn't mean that they don't have capacity or they have lost all capacity. I work with people with disabilities. They are my coworkers. They don't need guardians. They don't need people to tell them what to do. They need supports, but they don't need guardians. So once again, we need to understand capacity. If we have families here that do not understand or don't know the level of capacity of the loved one with disabilities, talk to the doctors, talk to the evaluators. They know. They have, you know, if your child has been in school, he or she has had so many different evaluations about IQ, about skills, so many different stuff that could guide you in terms of how much capacity your loved one with disabilities have. And then, you know, you rely on that information in order to see, you know, which is the tool that, you know, that you're going to utilize to support your child. Because keep in mind that because you apply for guardianship doesn't mean you're going to get it. I actually spoke with someone last week. She applied for guardianship for her brother. She didn't get it. She was denied because the brother have enough capacity to make decisions, even though he needs help. So we have to keep that in mind. Also, if somebody have capacity to make daily decisions about what they want to do as an activity, what they want to eat and all that, we don't want to take that away. We actually want to reinforce that person to be independent. And when you do and you take away you know, all those rights, you actually hurt the person's self-esteem. And what happened when you're no longer here? And you know, what is left for this person? Okay. I'm going here. I don't know if you changed the food because instead of the chicken one, I got the one that. Okay. I don't know. Give me 1 second. Sorry about that. Okay, so components of decision-making: ability to communicate a choice, ability to understand relevant information, ability to appreciate the nature of the situation, likely consequences, and ability to manipulate information rationally. So when we're making decisions, those are the things that we are considering. Now, interesting fact here. We all made the wrong decisions as humans every day. I make wrong decisions every day. However, when we are talking about people with disabilities, we expect that every decision has to be the right decision. And we don't respect that they can also make the wrong decision. Might not be, unless it's something that are going to put them in danger, then we have to let it be and let it go. I have a lot of people with disabilities that they're capable to say, I don't want to go to church on Sundays. And the parent is like, oh, I will need to get a guardian so he can make it to go to church. Also, we have to understand what guardianship does. A lot of the stuff that people call me about guardianship, the guardianship doesn't even address that. And we're going to talk about that. So, because I want you to open your mind about other choices. There are other choices besides guardianship that will support the person with disabilities. We also allow you as a family member to be part of decisions. And we leave, a lot of the decisions to the person with support. Once again, I'm not against guardianship either. If a person needs a guardian, that's what it is. But I think because guardianship was the only thing that existed for many years, parents only think about or only being told about guardianship because most people don't understand that it's something else that could be done or is in place. And we're going to learn all about that. Okay, how do we make decisions? We gather information, we understand the information, identify, consider, maybe yes, maybe no, weigh in, well, what are the cons? What are the pros of this? And then implement, communicate and implement. We do this every day. People with disabilities too, okay? Decision-making domains. This is like, of course, this is not everything, but what are decisions that we make every day? Where we're gonna live, our social activities, where we want to work, if we want to take trainings, if we want to sue someone, legal action, our healthcare, do I want to visit the doctor every year or every other year, and personal routine. Brush, do I feel like showering today? Am I gonna brush my teeth today? All this are the domains of decision making. Once again, some of you loved ones may have a lot of strengths here. They know exactly that they need to wake up, take a shower, or even with support, right? After you wake up, please, the shower is ready for you or whatever. So once again, when we're dealing with people with disabilities, we need to think about them as individuals of what they need, not what we think they need. It's really what they need, okay? I want you to start opening your mind and think about this way. Okay, so like I said in the beginning, there are public benefits such as Medicaid and Social Security that we need to preserve if we know our loved one with disabilities are going to be living or need those benefits to support themselves. So if we want to leave money behind, we certainly could, but we need to leave it in the right places. So I'm going to talk first about the general trust, which really is a fund created in which you put money to benefit somebody else. And simplifying here, you will have access to this PowerPoint if you want to know the details or you want to Google trust, but really at the core of a trust is you leave money for somebody else to benefit. There are a few people that are going to be named on the trust. One is the grantor, meaning the person who creates and funds the trust, the trustee, which is the person who manages the trust, and the beneficiary, which is the person who's going to obtain the money. Okay, so once again, this is a regular trust. What happened with people with disabilities? Well, if you want to preserve public benefits, then you need to open a different type of trust. And this trust is called the supplemental needs trust. Sometimes it's called the special needs trust. It's the same thing. And this is a special trust with the purpose to preserve public benefits. In other words, if you have a life insurance, if you have a house, if you have a pension plan, and you want to leave part of that those assets to your loved one with disabilities, you could, but you have to entrust it in order for that not to interfere with public benefits. Now, two things that you need to know about the trust is irrevocable, meaning you cannot change it. So if you're young and strong now, making good money, and you want to open a trust, and you said something happens to me, 100% of what I have is gonna be, for my son, including my pension, my 401k, 403b. Guess what happened when you are like 70 years old and then you need your own care? You already entrusted all what you have and you left yourself empty. So we cannot do that either. We need to think about when planning for our loved one with disability, but planning for ourselves too, because the trust is irrevocable. You cannot say 20 years from now, oh, let me modify it now, let me take this out and put this in. Okay, and it costs money to create a trust. That's the other part. Trust is not free. I don't know any nonprofits that create trust funds. So you have to be careful about your planning, and that's a conversation you're going to have with the attorney that creates this type of trust. Your needs, your wants, your vision, and also the trust is discretionary, meaning that for most part, when parents create trust funds, they are the managers of the fund. But as they start aging, then they assign somebody else. So keep in mind that if you're alive and you assign somebody else, that person could manage the trust whichever way they want to. And sometimes we do things without understanding the consequences. So discretionary meaning, the trustee will manage and will deny or refuse distributions. Meaning that, let's say if you pass the baton to somebody else, to your daughter, and your daughter is a trustee, and you call her and say, well, my son needs a new bedroom set. You're now the trustee, I need you to release the money. She might say, no, I don't think so. I saw his bedroom is fine. So once again, these are the things that you need to take into account. I'm just giving you an example. I know parents hate when I do samples about the other kids, but once again, anyone who's going to be the trustee could deny distributions. There are different types of trusts. We have the first party trust, and we have the third party trust, and I'm gonna talk to you about those two. Okay, so really, self-settle or first party is funded with the assets of the person with disabilities. Now, this means that it's the person's own money. Many of you will ask me, well, how my child is going to have money? He was born with a disability, he has no work and all that. Lawsuits. This is huge. Lawsuits. A lot of parents don't understand that when something happened to your child with disabilities or adults with disabilities and you sue, the money doesn't come to you. It's not for you. You're not able to manage the money. It comes for the person with disabilities. So what happened with that money, before you settle, you need to create a first party trust or self-settle with that money in order for that not to interfere with public benefits. So that's really the point of this, that now, if you are leaving money behind for your child, or your mom is leaving money behind for your child, your dad, then that's a different trust that is called third party trust. Meaning somebody is giving the money to your child and they put it into a trust once again to preserve public benefits. So that's really the difference. The first party trust is with the person's own money, lawsuits, medical malpractice, hit and run, whatever that is. When you settle that case, it should go into a first party trust to benefit the person with disabilities. And the third party trust is with somebody else's money. Now, what happened if you settle a third party trust with your money and something happens to your child and the money is in the trust? Well, the third party trust also give you the ability to name other people who will take the money if your child doesn't spend it all and something happens to him or her. So let's say later in life, you pass away, and then your son with disabilities pass away and has money left on the third party trust. you already have named who's gonna get that money. It could be your other kids or a non-profit, anyone who you name could get that money who's left. Okay. Also, because this is like to protect Medicaid, you have to keep in mind that every year, as the trustee needs to submit documentation how they've been spending the money, and that's good for you because it's accountability, and that's good for whoever is going to be the trustee-ness. You can just not just take out money and deplete the supplemental interest without letting the government know how you're spending the money. So once again, this is something that it needs to be done and to keep everyone accountable. Okay, there is also something else to put money aside for your loved one with disabilities, which is the 529 account, 529A able account. And this account was created with the purpose of, for people with disabilities to save money without interfering with public benefits, and for families of people with disabilities to put money to save money without interfering with benefits. Is created and run by the New York State Comptroller's Office. It's a maximum that you can put in the lifetime of this account. And it's also a good choice. It's also a very good choice. So if you want to learn more about it, if you want to open one more, it's an underutilized tool right here. These accounts are underutilized. So if you really want to put money aside, that is not the money from Social Security, please, because that's the first question that people ask me. Oh, can I put the Social Security money into an account? No, the Social Security money is to be spent on the person with disabilities. This is extra money that you want to put aside for your loved one with disabilities. So if you want to learn more about the details of the ABLE account, if you click in that link, that's a 529 ABLE account, it will link you to the controller's page, and all the information is there. Okay. The decision-making options for people with disabilities. The less restrictive, of course, the person maintaining their own decisions. Then we have the healthcare proxy, power of attorney, and supported decision-making. Then the most restrictive is guardianship, surrogate decision-making, and we talk about power pursuant to the Family Healthcare Decision Act. So we're going to start with the less restrictive, which is power of attorney and healthcare proxy. Now, keep in mind in red, you see here, the person with disabilities must have capacity. So your loved one must have capacity in order to appoint you as their agent for either document, either for power of attorney or healthcare proxy. People get confused about this quite frequently. They tell me, my child has no capacity, but he knows how to sign. Can I get a healthcare proxy? The answer is no, because the individual must have capacity to understand that you're going to be their agent and you're going to make decisions when not capable to make those decisions. The other misconception about special healthcare proxy that once you are the agent, you make all kinds of decisions. It doesn't work like that. You read here says the healthcare proxy only takes effect after 2 doctors decide a person no longer has capacity to make their own decisions. So this is not daily. This is only when this person is, for example, in a coma, in an emergency, at that moment they don't have capacity to make decisions. Somebody needs to sign, then 2 doctors get together and say, obviously this person doesn't have capacity to sign on treatment. Who is the agent for this person? And that's when you come along with that, okay? The healthcare proxy, if you look at an example of healthcare proxy, you also have check boxes. So the person who has capacity, the person with disability who still have capacity, would check the areas that they're only asking you to intervene. It's not for everything, okay? And by the way, this is not for people with disabilities, it's for everyone. We all should have healthcare proxies. Power of attorney works the same way, except it's for financial decisions. If I suffer from, for example, major depression, and I know every so often I cannot get out of bed, I cannot do anything, then I probably have someone who will be my agent to go into my computer or his computer or her computer and pay my rent pay my bills because I can't even do that right now. So that's for you is the power of attorney, which is two different types of power of attorney. One that is springing, that only grants authority when the person becomes incapacitated. And there is the durable, which is the traditional one that it comes into effect immediately. But once again, power of attorney is also a document that have checklists. You're not making decisions for everything. The person is gonna check you as an agent, what are the powers that they're giving to you? And you have to be clear about that. Okay, supported decision-making. I have mentioned this throughout today, and I want people to listen because this is the other option besides guardianship. Once again, if you have loved one with disabilities and they have challenges, however, they're able to communicate their wishes, they're able to communicate, and they're doing pretty good. I have people with disabilities, students with disabilities, because I do the work with special education, right? That they are, in path to get the Regents diploma. They're thinking about college. They don't need guardians at all. They might need someone to support them. Now, supported decision-making might provide that support that you're looking, because I also understand the perspective of parents. Parents get afraid about what's going to happen with my child. He has a disability, he has trouble, or he forgets. Well, this is a document actually that is going to support you in supporting your child. How beautiful is that? Okay, so you have a process here that is called supported decision making, in which they're gonna assign you a person who's gonna work with the family in order to identify the areas in which your child will need help, and then they're gonna draft a legal document in which called an agreement, in which areas you're gonna be able to support your child. And there are rules about this. It's totally put in place. We have rules. Mental hygiene law. It tells you exactly what is your role, and it tells you exactly what you must do. It lays out everything for the family, and it's a process. It's an intimate process with supported decision making, in which they help you along the way until you end up with an agreement that lays out how this is going to work. So that allows the individual with disabilities who have some level of capacity to continue making decisions on their own, which actually help the independence and self-esteem, and also allows you as a family member to continue what you're doing since your child was born, supporting your child. So this, I command people to read about this and look into if this is the right tool for my child. Once again, everyone is different. You might have a lot of people in this forum that this is perfect for their child. I understand that another group that maybe guardianship is for them. There's a small group for healthcare proxy and power of attorney. So once again, and by the way, supported decision making is not absolute, nor is guardianship, by the way. Supported decision making, if your child is young, able to make some decisions, you want to support, you go for it. Later in life, and that happens a lot of, and it could happen to anyone. If the child have, health deteriorates and the cognitive abilities also go down, then you can eventually apply for guardianship. Is that the next step? So because you have supported decision-making agreement doesn't mean that you cannot apply for guardianship when needed. But this is probably going to cover most of the stuff that you're looking to cover. So I will suggest for you to explore this. There are the links here, videos with, I would suggest for you to watch the videos from individuals with disabilities who have gone through the process. It's really moving. The fact that they really appreciate that the parents allows them to be independent and to make their own decisions while still support them when they need it. It's really, really moving. If you want, to start the process, you contact Supported Decision Making. Is their own organization, and they are actually this year, I think they were granted money from OPWDD. So they're working with OPWDD as well. So this is really something that I encourage you to read and to explore. Even if you call support decision making, they explain everything to you. They're also going to explain to you if this is not for your child. So once again, open your mind, let go a little bit of your guardianship mind, and open to other options. Once again, this is all about decision making. It's a lot of information. If you want this PowerPoint, ask Tatiana or ask me, email me, and I'd be more than happy to do it. So for people at this moment that they have adults with disabilities and they don't have anything in place, they don't have guardianship, they don't have support decision making, the person doesn't have enough capacity to sign on a healthcare proxy or power of attorney, and something needs to be done. They say, and this is a true example, when a lot of people with disabilities did dental work, and they need them to put them to sleep in order to work with them, and there is nobody to sign because this is an adult, there is no guardian in place, there is nothing, and people panic. Don't panic. There is something called surrogate decision making, in which, you know, it's document that you fill out, the doctor who's gonna do the procedure fills out, send it, and then you will be requesting approval for this particular procedure. It's only a one-time thing. It shouldn't be you always thing, only because you didn't know this is happening and you weren't prepared, then this is assist. Now, in terms of emergency, because this is what people ask me all the time, doctors swear to save lives. If you shall have an emergency and I have an emergency, they're gonna save us. They're not gonna ask for guardianship or for who's the decision maker. This is mainly as guardianship and other documents for procedures, or, you know, to make sure the doctor wants to make sure that the people who are authorizing procedures are the authorized person. That's all, because they don't want to lose their license. So don't kill the messenger when you go to the doctor and your child is like 25 and the doctor said, well, who's gonna sign? Because they acknowledge that your child doesn't have capacity, and you're like, oh, but he's coming here from 10 years, why are you asking me? It's, you know, it's not like the doctor have something against your child. It's like they want to protect the license, and they have the right to do so. So once again, in the case of an emergency, this is something that, you know, could help you with that procedure. I have, you know, a grandmother going through this, because that's the example that I gave about the dentist. So something there also. Okay, I already talked about that. Then let's talk about guardianship. So a guardian is someone appointed by the court to make a decision on behalf of somebody else. There are different types of guardianship. You can be guardianship for the property, financial decisions, which in the case of people with disabilities, if they don't have anything, you don't need to apply for property. And it's also guardianship of the person, and there is both. So the guardianship for people with intellectual disabilities and or developmental disabilities called guardianship 17A. So once again, we have to keep in mind what's the name of the guardianship, because I have someone who called me and they were applying for the wrong guardianship. Okay, so this is guardianship article 17A, specifically for people with developmental disabilities and or intellectual disabilities. It's a court proceeding. However, you don't need an attorney. This is paperwork. This is paperwork. You need to fill out applications. There's no one form. It's a series of forms that you fill out. You don't need an appointment to submit those applications to court. You just go and submit. Now, the forms live online. You don't need to go to the court and pick up paper. Also, strongly recommended, if your child is eligible for guardianship, if you think he or she is, don't write those applications by hand. You might have a beautiful handwriting, but let me assure you that the clerk at the court is not going to try to figure it out what you wrote. So that's why typing is the way to go. The forms live online. You don't have to do everything in one day. You can type, save to your computer, and come back to it. You can also copy and paste from one form to the other because they all start the same way. There is also do-it-yourself guidance to answer your questions. It's super easy. You do the do-it-yourself guidance and you ask some questions and the computer populates your form. So super easy. There is no reason why, if this is what is appropriate for your child, that you're not able to do it. I know people are afraid of legal documents and all that, but let's say if you submit it and you have mistakes, the clerk will let you know, and then you redo those pieces. And they explain which document, what document, is. This is, if you're a couple, mother and dad, and you both applying, then fine. If you divorce, is that person going to be included as a standby guardian? Then that's fine. If that person is not going to be included, then there is a document called the waiver. If you were in a bitter divorce and that person, the other person lost their rights, they don't need to be included. You just submit the papers that of the divorce that said that that person lost their rights. So it's so many different things here. Don't panic. Once again, consider supported decision-making and that process. But if guardianship is the one appropriate for your child, then you have all the tools online, all the tools. Here are the different courts in New York City, the Bronx and all that. You apply in the place in which your child resides. So for example, if you have an adult, this is not kids in a school, it's adults that live, for example, you live in the Bronx and your child lives in a residential facility in Queens, then you will have to apply in Queens, because this is about jurisdiction where the person with disability live. If you click that icon, that link, it will link you to the forms, okay? And once again, there's so many supports in terms of how to fill out the paperwork with the, in the page of the court, that I assure you that you're able to do this. This is other resources here that, and this conclude the piece of the presentation, but I'm willing to answer some questions. So now, before Tatiana started reading me questions, I went ahead and asked and read some of the questions. Somebody was asking about OPWDD. So to apply for the OPWDD, in order for your child to start connected with that system, there are agencies that are called care coordination agencies who could help you along the way to start that process. You can call OPWDD directly as well, but you can also call the agencies to start helping you with the paperwork. Okay, I also believe that, and I don't want to provide the wrong information, Synergia also have a little bit of input in that, in the process. So if you want the name of the agencies or the care coordination agencies to start this process, I'd be more than happy to send you an email with that information. However, I don't want you to sleep on it, because your child, if your child is not already in this system and he or she is eligible, you're missing out. He's missing out. She's missing out a lot of extra services and a lot of extra support. So I encourage you to start that process as soon as possible. Okay. Now, if you get denied for OPWDD, you can also give me a call at the main number, because sometimes we look into the denial to see if OPWDD made a mistake or really your child doesn't need OPWDD. Once again, I want to be clear, the fact that your child is a recipient of special education services doesn't mean that they're eligible for OPWDD. People sometimes don't realize that. They call me and they say, well, my child have an IEP since kindergarten and he's not eligible for OPWDD. It's two different systems. Your child could be all their life in special education and might not be eligible for OPWDD. So the only way to know is to apply. I have another person who has a question about Social Security application. My office doesn't do benefits, so I'm probably the least person to guide you. But you could be working. I think the person is working, and you could still apply for Social Security. It doesn't mean you're gonna get it, but you could still apply and see what they say. And the application lives online as well. You can fill out the application. They're gonna ask you for information, and then they're going to tell you whether you're eligible or not, because not everyone who applies for Social Security rules are very strict, by the way. So some people are eligible, some people are not. So try it to see what that lands you. And I think I already answered the question about the residential. If your child is a minor and he is in a residential school, nothing changes. You're still the mother, father, family member who is making decisions for him or her. That doesn't change because your child is in a school. It's a school. And even if an adult with disabilities go to a residential facility to live with other people with disabilities, you need to establish if this person have enough capacity. They're going to maintain the capacity to make their own decisions. If they need help, once again, you can do supported decision making, or if they're severely disabled and they need a guardian, then you go for guardianship. However, the residential facilities for adults, so they have documenting which, someone could be assigned as that person advocate. And what that means is you're gonna be involved and they need to let you know what's going on, and, and you will decide. Okay. Tatiana, do we have any other questions?
Currently, we do not have any questions. So whoever is on the Zoom, if you have any question for Paola, you're more than welcome to type it in the chat, type it in the QA box, or even I could allow permission to talk if you would like to ask the question to her directly instead of typing. You just have to raise your hand and I'll just unmute you. Other than that, so far we don't have any questions via our Facebook. Like I said, the floor is open. If there is no questions for today, or the questions that you have are more in a private matter, I can always connect you to Paola at the end of the presentation, so you can ask those questions directly. We do have one in the chat now from Miss Camacho. She says, I want to be the sole representative to my son who is 18 years old, but I also want my second son to be the next representative, although he is 15. What should I do?
Okay, when we talk about representative, are we talking about guardianship? Is that what we're talking about? I assume I'm gonna assume it's guardianship. So a few things. One, Ms. Camacho, thank you for your question. Two is, explore capacity for the son that you're talking about with disabilities to see if he or she really needs guardianship and supported decision making is not enough for him or her. Also think about what is the goal of guardianship in general. What is it that you're trying to accomplish with guardianship? The second part, if your other son, which you want for him to be a standby guardian, he needs to be 18. So a few things you can do if you are afraid, like many parents are in panic about guardianship. You can apply. You can apply for guardianship, put yourself as the solo guardian, and then when your other son turns 18, you can add them as a standby guardian or co-guardians. You're gonna have to amend the document. Now, keep in mind here, and this is for all parents, everyone who's here who has siblings who want to add them to the guardianship. Before we do that, I love to do this before Thanksgiving because Thanksgiving is coming. We need to talk about our other kids, about guardianship and what entails. Because remember, our other kids have dreams and have goals and they want to do something. So sometimes, and I say this from a place of used to do siblings groups, sometimes they feel that it's a very heavy burden to be their siblings guardian or co-guardian because parents have not explained what it is. Now, I'm going to give you an example. If I have a brother with disabilities and I myself is struggling, I live in public housing, I have 5 kids on my own, I also have kids with disabilities. The fact that you want to add me as a guardian, it might cause me a great deal of stress. Because in my mind, if I don't understand guardianship, you might think that, oh my God, if something happens to my mom, I need to bring my brother here to my house and I don't have a space and my life is like so out of hand. So once again, I'm giving you this example because I heard it from other siblings. Talk to your children about this. Keynote here. The fact that somebody is somebody else's guardian doesn't mean that they have to live with that person. So Ms. Camacho, if you want to have that conversation with your son, who is 15, he'd probably be happy to be a standby guardian when he turns 18. However, you also need to explain to him that the purpose of this guardianship is for him to keep an eye on the brother when you're no longer here, and that if the brother is, there are programs in which the brother could live independently with services, doesn't have to come to his house unless he wants him to, of course, or unless he have the space, because sometimes it's not even a choice. Sometimes when we live in certain housing, you cannot bring nobody else because you lose your housing. So once again, we need to think further here and expand our vision and also understand what guardianship does and how serious this is. Because if something happens to you, this other civilian is going to have to deal with programs, with services, with housing, with everything, with health issues. So everything, and imagine this, right? Once again, I love to talk to families. So sometimes the parents, said, oh my God, I adore my child, but this have caused a lot of stress in my life. This is a lot. I always have to be on the phone, try to figure out services. If I lost this, if Social Security, stop paying, all this. Imagine giving that to somebody else that have no idea about life at 18-year-old. So once again, I see it all the time. Most of the time, siblings are, willing to help, willing to join into, being a co-guardian or whatever, but we need to explain and we need to leave that door open for them to decide. Cannot assume that because this is the only sibling, they're gonna be happy-go-lucky doing this. Okay, so just a little bit of preaching here, but I want you to think about that.
Thank you, Paula. Ms. Jonah Hurtado is asking, I want to ask if you can tell me about a lawyer who can help me with the trust fund for my child.
Okay, so I usually don't recommend anyone because once again, we don't have that practice. I don't want to be called back and said he did or he or she did a awful job. If you fall, Paula, you recommend it. What you can do is there is the Association of the Bar of the City of New York, and they have the list of everyone who practice, and this is gonna go under elder law attorneys. Please make sure that you get someone who is an expert in this area. And I'm gonna tell you why. Because if you, for example, you flip houses and you have a real estate attorney who help you with those documents, probably that's not the person that you want to recruit for this, because these have details that, by experience, a person who's doing this work, attorney who they do wills, they do trust funding, this is the people that you want to recruit. So call the Bar Association, everyone is, signed there. So you can ask, they even have 30 minutes free consultation. Because this is a sit-down thing. This is a sit-down in which you have to express what you have, how you want to do this, you want to save money for your own, up on age. So once again, and you can do, most of the time you're gonna do a trust fund with a will, because in the will, you're gonna put everything that you have, and then you will say, for my son who has disability, Johnny, 20% of what I have, it will go to his trust fund. So those two will go together. So once again, you also can reach out to see if other parents in your circle already have utilized someone and they've been happy with their work. I know there is a firm somewhere in Long Island that one of the attorneys have a daughter with disabilities, and she does this. She's probably a good person just because she's in the situation as well. So once again, do a little bit of research before you go and, start this process.
Thank you, Bella. And we do have another question from Mr. Stefan. He says, hi, how to apply for benefits for my child who's 17 years old?
Once again, we don't do benefits, but you can't do it yourself. You Medicaid and Social Security, all those applications are online. They tell you exactly what to submit. They walk you through. I know we all want somebody else to do it for us, but once again, if your child doesn't have a care coordinator, doesn't have an agency who is already helping, then you're gonna have to do it yourself. Once again, there's also other agencies, nonprofits that do benefits, but most of the time they focus on denials or stuff that have gone wrong. But in terms of the application itself, I think most, people, they're in a way that most people should be able to apply on their own.
Thank you, Paula. And we do have another question from Ms. Peterson in the chat. How do you get a power of attorney for an adult child with special needs who cannot say specifically he wants us, his parents, or his legal guardians, power of attorney for him?
Okay, once again, power of attorney requires the person with disabilities to have enough capacity to identify you as their agent. If that person doesn't have any capacity, then we're looking at the wrong document, because that person literally have to read the power of attorney, check what you're gonna be, in what areas you're gonna be their agent, and then signed in front of a notary public. If all that your child is not capable to do because they lack capacity, this is the wrong document. You need to look at other things. Supported decision-making, perhaps. Guardianship, once again, this is like an out in the air question, just because I don't know anything about your child. And if you want for sure to know which tool is going to be the best, you need to read into their evaluations. You need to ask the doctors about his level of capacity. I don't know if the person that you're talking about, have, I don't know, a very low IQ, intellectual disabilities, profound autism. I don't know. So once again, you are the one who has that information, and you have to look and talk to the people who have been evaluating your child to give you a better idea and to guide you, because healthcare proxy and power of attorney requires capacity, because it's not only for people with disabilities, for all of us. We should all have a healthcare proxy. But once again, you have to have that capacity to say, you know what? If something happens to me, I need to have a document in which I assign my husband to be my agent so he could make the decisions as I told him to. If your son is not capable to do that, then this is not a document.
Thank you, Paula. As of right now, we don't have any other questions in the chat or Q&A. So this has concluded our presentation. As I mentioned before, I will be pulling up a poll for everybody who is here in our Zoom space. So please do stay for a few seconds. Paula, thank you so much for this valuable information today. If anybody needs to get in contact with her directly, I will be providing her contact information in our follow-up email along with the presentation itself. So you can reach out to Paula with any questions of private matter. Again, Paula, thank you so much. And for those seeing us via Facebook Live, thank you for being here.
My pleasure. My pleasure. Have a great day, everyone.